Do you feel joint pain that just won't go away? Or maybe you know someone who struggles with stiffness and swelling that makes everyday tasks a challenge. If so, stick around. Today we're talking about rheumatoid arthritis. It's more common than you might think, and while it's often misunderstood, there are actually ways to manage it effectively and improve quality of life. In this video, we'll explore the causes, symptoms, and remedies backed by science to help you or a loved one navigate life with rheumatoid arthritis. Welcome back to the channel. If you're interested in learning more about health and wellness, you've come to the right place. Today's topic is rheumatoid arthritis, a chronic autoimmune condition that affects millions of people around the world. By the end of this video, you'll understand the root causes, common signs, and the latest treatments and remedies to help manage it. Let's dive in. What is rheumatoid arthritis? Rheumatoid arthritis, or RA, is a chronic autoimmune disease that primarily affects the joints. Unlike the typical wear and tear of osteoarthritis, rheumatoid arthritis happens because the body's immune system mistakenly attacks the lining of your joints, called the synovium. This leads to inflammation, pain, and eventually joint damage if left untreated. RA doesn't just stop at the joints, it can affect other systems, like the lungs, heart, and even blood vessels. Understanding this disease helps in managing it more effectively, so let's look at what exactly causes it. While the exact cause of RA isn't fully understood, researchers believe it's likely a combination of genetic, environmental, and hormonal factors. Here are the primary triggers science points to. Number 1 is genetics. Studies show that certain genes increase the likelihood of developing rheumatoid arthritis. Specifically, the HLA-DRB1 gene has been linked to a higher risk of RA. However, having this gene doesn't guarantee you'll get it. It just means you're more susceptible. Number 2. Environmental factors. Environmental triggers, like smoking, pollution, and even certain infections, can increase the risk of developing RA. For example, studies show that smoking can actually double the risk of RA in people who are already genetically predisposed. Other triggers include viral and bacterial infections, which may activate an immune response that leads to inflammation in the joints. Number 3. Hormonal influences. Women are 2 to 3 times more likely to develop RA than men, suggesting a link to hormones. Estrogen, in particular, is thought to play a role, although the exact connection isn't fully understood. Recognizing the symptoms of rheumatoid arthritis early on is key to getting effective treatment. Here are the main signs to look out for. Joint pain and swelling. RA commonly affects the smaller joints in the hands, wrists, and feet. Pain and swelling in these areas is usually symmetrical, meaning it affects both sides of the body. Morning stiffness. One hallmark of RA is stiffness that's worse in the morning and lasts for at least an hour. It's not just the typical stiffness you feel from sleeping in an awkward position. It's more intense and doesn't go away easily. Fatigue and weakness. People with RA often feel exhausted, even if they're getting enough rest. This is due to the body's immune system being constantly active, which takes a toll on energy levels. Other symptoms. RA can also cause symptoms outside the joints, like dry eyes, chest pain, and even issues with the skin and blood vessels. If you're experiencing a range of symptoms along with joint pain, it might be worth consulting a doctor. Now, let's talk about managing RA. While there's no cure, there are effective treatments and lifestyle adjustments that can help control the symptoms. Medications. Medications are often the first line of defense against RA. Here are the main types. NSAIDs, nonsteroidal anti-inflammatory drugs. These are common pain relievers like ibuprofen and naproxen, which help reduce pain and inflammation. DMARDs, disease-modifying anti-rheumatic drugs. DMARDs, like methotrexate, are designed to slow down the disease's progression by targeting the immune system. Biologics, a newer category of drugs that target specific parts of the immune system. Biologics are often used when DMARDs alone aren't effective. Examples include Humira and Enbrel. Lifestyle changes. Along with medications, lifestyle changes can have a huge impact on managing RA. Exercise. Low-impact activities like swimming, walking, and cycling can improve joint flexibility and strength without adding stress to your joints. Regular exercise also releases endorphins, which can help manage pain. Diet: an anti-inflammatory diet rich in omega-3 fatty acids, antioxidants, and whole foods can support joint health. Foods like salmon, leafy greens, berries, and nuts are great options. In fact, studies show that omega-3s can help reduce the severity of RA symptoms. Physical therapy and occupational therapy. Physical therapy can improve joint function and reduce stiffness, while occupational therapy offers techniques for making daily tasks easier on the joints. Natural remedies and supplements. In addition to prescribed treatments, some people find relief with natural remedies. Here are a few options backed by some scientific evidence. Turmeric: this spice contains curcumin, a compound known for its anti-inflammatory properties. Studies suggest that turmeric can help reduce RA symptoms. Fish oil: rich in omega-3 fatty acids, fish oil has been shown to reduce stiffness and pain in people with RA. Ginger: ginger also has anti-inflammatory properties and can be easily added to meals or taken as a supplement. It's important to see a healthcare provider if you experience persistent joint pain, stiffness, or any of the other symptoms we discussed. Early treatment can help slow down the disease and improve your quality of life. If you're already diagnosed, it's also essential to keep regular checkups, as RA can progress over time, and treatment plans may need adjustments. Rheumatoid arthritis can be a challenging condition, but with the right knowledge and support, it's possible to manage symptoms and lead a fulfilling life. Remember, a combination of medications, lifestyle changes, and natural remedies can help make a big difference. Thanks for watching, and don't forget to hit the like button and subscribe if you found this video helpful. Let us know in the comments if you have any questions or if there's another topic you'd like us to cover. Take care and stay well. If you or someone you know is affected by rheumatoid arthritis, share this video with them. They may find it helpful. And if you want to stay updated on more health and wellness tips, make sure to subscribe and turn on notifications so you don't miss our next video.